the title of the video, did you read that? I have cancer. We're going to talk about the hows, whys, and whats of that in just a minute. But let me also tell you that it's very, very, very important for you to have gum checks once a year. Macy, again, very important to have gum checks once a year because you need cancer screening of your gums and your tongue, and they might pick up thrush, or they might pick up something. The dentist might see something that's wrong that you don't know that's wrong. That's wrong. Yeah. So you just don't know. So make sure that you do that. I have a friend. Let me talk about my friend for a minute. And I'm only going to tell you a piece of this because I think she might do a video with me. And we're going to talk about this because she ended up with gum cancer. And she lost all of her teeth, most of her teeth. And now wears dentures and doesn't have bone in her jaw or in her. It's her story to tell. I'm going to let you tell her. I'm going to let her tell that one because it's very, very important that you go to the dentist still. And I remember sitting talking to her and oh, that won't be me. It was like my cancer that I have. Oh, that would never be me. Listen, that never would be me. It's me. It's me. So anyway, what do I have? I have skin cancer, 2 spots. One is a squamous cell, one is basal cell, and one is on my face. So in the upcoming videos, you might see, in fact, at the time that you're watching this video, I had the first surgery yesterday. I had the one on my face yesterday. So you may end up seeing a bandage here. So I'll show it to you and let's talk about this for a minute because can you see it right here? Right here, this little bump right there? Which it might be white looking because it's full of sunscreen right now. I was a tanning bed-aholic. I was in the tanning bed all the time. For like a 10-year span. I tanned all the time. My mother would say, "You're going to get skin cancer." And I'm like, "Yep, okay, Mom. I got skin cancer." Yeah, I know that's not funny, but it is what it is. So anyway, I have basal cell right here. And they're going to do the scraping procedure, which I forget what it's called. And they're going to they're going to take some out and go look and take some out and go look and just keep doing and digging until all of it is gone. I can tell you that this spot has been right here for well over 15 years at least. So I don't know how big that's going to be. I just don't know how big that they're going to end up taking out from here to here. I have no idea. But we're also going to talk about that in a minute because God has me where he wants me. I know he has me where he wants me right now. And right now it's dealing with this. That's where he wants me. And somebody said to me recently, I'm going to show you the other spot in a minute, so stay tuned. Somebody said to me recently, "Michelle, what are you going to do? Your face is your job." And that just didn't sit right with me. And I'm the type of person that I have to think. I mean, somebody will say something to me and maybe I'll think about it for 2 days later and I'm like, "Hey, I have an answer for you now. I have a comment, I have whatever." But I'm a processor and I'm a thinker. So I thought on that for a little bit while because it didn't sit right with me. And I'm like, well, I don't know. That just doesn't, no, that's not. So I told this person, because this person also said, you need to go see a skin doctor. No, a plastic surgeon. If you're going to have it's your face. I'm like, no, no. My heart is my job. I text back to them. My heart is my job. My face isn't my job. It's part of my job that I use as a prop. My face is a prop. But my heart is my job. And that's truly the way I feel about this. My heart is my job. So if you're getting dentures and you're new at this and you're going to have all of your teeth pulled out, your heart is what matters. Not your face, not your teeth, not anything like that. It's your heart that matters, because people usually fall in love with somebody's personality and their heart, not their looks. You know, most of the time. So what matters the most is your heart. So that's what matters the most to me. So I might be filming videos with a hole in my face, a big scar. I have no idea. If I need to see a plastic surgeon, I will. If it's like, if they can, I have no idea. But it doesn't matter to me that I need to do that. And I'm going to film with a scar on my face. I don't know. It might be big. It might be small. By the time you're watching this, I might know. And I might be in the chat. And I might tell you. There. How's that? I know I'm going to be in the chat, so I'll tell you. So, okay. The second, the squamous cell. This is right, let me see if you could see it, right here. Okay, see that? Okay, about a month ago, that's the white is sunscreen. But about a month ago, this knot popped up overnight. Just overnight. It was like the size of a small grape. In fact, it was biopsied last week and it's already grown. It's already grown since then. So what did I do? What do you normally do when you have a bump on your arm that looks like a pimple? You squeeze and squeeze and squeeze. Well, I did that and nothing came out. I ended up with a bruise all the way around it. And I showed my doctor when I went in there and I'm like, I got this thing on my arm. He goes, oh, I think you need to see a skin doctor. And I'm like, oh, okay, we can do that. So yeah, so there's that. So they're going to remove this one August 31st. So this one's going to be not the scrape and look and dig, and they're just going to remove a big piece of this and then stitch it up. And they're going to stitch this up too. So I'll be like stitched. I don't know. So that's my life right now. I've had a few spots removed on my chest, so you can see the scars. But they were like nothing serious or anything, just a few spots removed. But when I went in for this thing to the skin doctor, I said, hey, I have this little thing here that my granddaughter once in a while, she would refer to it as a booger. Great, J-Ma, you got a booger on your there. I'm like, oh, that's a pimp, that's a mole or something, I would say. I told the doctor, I said, oh, hey, I've had this thing on here for years. She went, oh, I think I need to biopsy that one too. I'm like, oh, that's serious? Now, I have been to skin checks before. I've done that. In fact, I did that about 2 months ago. And it went so fast. He didn't even notice this on my face, and I didn't wear makeup. So just so he could see everything. Well, he missed this. I've had several skin checks, and this has always been missed. So, I don't know. But anyway, your heart is what matters. Your heart. That's what matters the most. And it should matter. That's what should matter the most to somebody. And if you're single looking to date somebody, find somebody that loves your heart. And it doesn't matter at all how you look. Because I guarantee as you get older, you're going to change and you're going to get wrinkles and you're not going to look like that same person years and years and years ago. So, yeah, there's my cancer story. Squamous cell, basal cell, and surgery already done, already taken off. And, yeah, I'll see you around with the Band-Aid on my face probably. And I'm going to smile. I'm going to smile with my Band-Aid on my face. In fact, I might buy Princess Band-Aids. And, oh, let me tell you a funny story. I won't keep you, but this is really funny. I have a granddaughter that's just going to be turning 3. And over the last month, she has discovered Band-Aids. And you know, kids, they discover Band-Aids. What do they want to do? They want all of them. So I was picking up a Target order for my daughter, and she's like, oh, I put some Band-Aids in the Target order for her because we went through all the Band-Aids yesterday. And I'm like, oh, okay. So what do? I stop at the dollar store and I buy 4 boxes of Band-Aids with, maybe there's 40. I don't know. I don't know how many was in the box. How many were in the box? Were in the box. But the child went through all 4. There was over 200 Band-Aids that she went through in one day. And we just let her because it was so funny. We had Band-Aids all over us. She had them all over her. They were all over the remote control. They were on her baby dolls. She just had a ball with all these Band-Aids. So, yeah, you want to entertain a almost 3-year-old, buy him a box of Band-Aids. They'll be quite happy with you. I don't know. Maybe I could borrow one. Oh no, she used them all. I can't borrow her Band-Aids. She's used them all. All right. There you go. So I'll see you around with the big hole in my face, stitches, and all the things. And yeah, go get your skin checked. And go get your gums checked too. It's very important to get your gums checked. All right, I'll see you in my next video. If you're still here, I will post a picture on my community tab of what I look like right now. I'll do that. Yeah, I'll do that. So if you're on the YouTubes, go, like you see videos, playlists, all of that. Look for community. Hit that, and you're gonna see my boo-boo. All right, you guys pray for me, and I'll see you next time. Bye.